We recently hosted a webinar on Beyond the Bedside, looking at the impact of technology in non-clinical operations in healthcare, particularly talking about the opportunities for workflow improvement and productivity in in hospitals. During that webinar, one of our guests was Mobley from Honeywell, and we're fortunate enough to have him join us again today. So we thought we might delve a little bit more deeply into the Honeywell solutions for Beyond the Bedside. Will, welcome. Thanks for joining us. I know it's late over in the US. Um, I'd like to start maybe with sort of the way we framed the conversation as initially was as hospitals look to improve their efficiencies, improve their productivity. There's lots of opportunities, I guess, in this space to leverage some of the technology that you've developed in other industries and bring them into healthcare. I was wondering if you could share with us a little bit about what you've seen in the US, what you've been working on potentially in the US, and things that you've extracted from that experience, and perhaps some examples that could apply to our markets.
Yeah, absolutely. It's a great question, Mark. And I think health systems today are focused on a lot of things. There's a lot of areas they're looking to address. And I think if I want to go from a 30,000 foot view, I'd say the big theme is digital transformation. And I know it's a big buzzword, but within that, if I move a little closer, I think health systems and even especially outside the clinical space are looking to do three things: stay connected, whether that be people to technology, or even technology to technology, like the Internet of Things, keeping technology communicating with one another. The other is the other two really could be tied together: user experience and modernization. I think we're seeing a big focus, a lot of investment in healthcare, and rightfully so, goes towards the clinical space. Because we want patients to be healed, we want surgeries to go well. And so a lot of technology and investments made there. But sometimes outside the bedside, those things or those areas are often forgotten, or maybe second thoughts in some cases. But they're just as critical to play a role, to have the right medicine, with the right patient, the right dose, the right time. We talk about it all the time. Without the outside and non-clinical spaces helping, none of that is possible. And so I think the other two themes that I think we're addressing and seeing quite a bit of health systems focus on is user experience and modernization. And from a user experience level, that could be using technology, excuse me, as a worker or as associate. So if I'm in a supply chain, or maybe I'm in a courier environment where I'm using technology and a device to take specimen from one area to another, I want to make sure it's easy to use, it's comfortable, it's fun to use. That makes me enjoy my job more. But even if it's not a clinic, not a worker, excuse me, but maybe a patient, for example, a kiosk environment. So a patient, they walk up to into a clinic or into a hospital, and that's the check-in environment should be seamless for them. And that's vitally important, because nobody wants to come in and wait in line for 30 or 40 minutes and then go in and get your help at a hospital. We already probably don't want to be at a hospital to begin with. And so actually spoke with a customer recently, and they had 120 people come into their little clinic in 1 hour. And so they had two people, front desk agents, front desk assistants, helping process paperwork, process people. And so one of the things they're working on, and we're helping them with, is develop a kiosk using one of our tablets that you can integrate scanning into. That way people can come in, they can scan a barcode, they can put in their insurance information or their health payment information and cards, and automatically get through the processing, and they can be in the waiting area and get into their doctor and get help faster. And so that improves the user experience, which in turn is going to help health systems gain loyalty, not just by their own employees, because when you have technology that's fun to work with and fun to use, you're more likely to want to come to work, but also for customers and patients. And when they have a seamless and enjoyable experience, and it starts immediately as soon as you walk in the door, in that case, they're more likely to come back when they have a health issue, or in the future need in the future. So it's improving connectivity between people, technology, and improving the experience by modernizing what you're currently using today. In many cases, it's making an impact on health systems.
It's an interesting point around the keeping people connected, because we've had a lot of experience here with mobility sort of solutions rolling out into the clinical environment. Big projects looking to improve patient outcome, but in our experience here, there's been a little bit of a gap looking at that other side of the healthcare business, which is around that supply chain enablement. We know, for example, that for every frontline worker, there's at least two people working in the healthcare environment behind them to support them, on average. Has that been your sort of experience in the US as well? Have you seen the predominant focus initially being around that clinical space? I'm just curious what trends you've seen in the market, which maybe have shifted to start to look at the space, which is perhaps not the most obvious thing when you're walking into a hospital for an average person.
It is, and you're spot on. In fact, it's hard to believe, and I'm sure it's the same in your space as well. But some health systems still use handwritten notes in the clinical space, but then even in the supply chain. And we've actually had some health systems where they're handwriting inventory, or they're using very basic procedures to scanner, and then it goes up into a system in the cloud, and we don't know where it goes. And so we provided mobile computing, mobile devices, which gives obviously scanning capabilities. You can automate workflows using barcode scanning, but also just gives visibility right in front of you to where inventory is, how much you have, and that goes right into the inventory management system that then connects into the clinical environment. And now a nurse who's in her at her work or in her role at a hospital can see what they have in inventory, what they have in stock, right on her tablet or her device, and it's the same thing that a supply chain environment can get as well. So it's connecting. You mentioned that connecting people. That's one aspect. The whole healthcare value chain is connecting the dots from the supply chain through the to the hospital, receiving it at the hospital, and all the way into the clinical environment. And you can see it all on your mobile device.
Look, one thing I think, and I'm sure this is universal, right? We see big pressure on costs within the hospital environment. They're
Yep.
trying to reduce costs, and a big trend in working throughout every industry is around trying to enable people to be able to do more with less, find ways to improve that productivity, but also enable people to be able to work where they need to when they need to. And my experience, anyways, traditionally the supply chain within a hospital was sort of a separate, complete separate system with a bunch of people who worked down in stores and a bunch of people who delivered things to the different wards or the different departments. Um, I guess the Honeywell technology has some pretty impressive, impressive products and offerings, which kind of wrap around healthcare quite nicely and maybe can provide a lot of value back in terms of addressing some of those cost savings, but enabling people to work where they need to work. Are you able to share maybe some examples of that technology and where you've seen it applied within your market?
Absolutely. And it's funny, you do more with less. We're all asked to do that, whether it's people or now it's applied to our devices and technology. So in the clinical space, or even as we move outside of it, one of the neat things is our mobile device. It has multiple features. It's scanner, of course. You can use it a phone. I can use it to take pictures, video chat. And one of the values is that it really is turning from a device or a phone into a computer itself. And so, for example, if I'm in a clinical environment, I can take my mobile device, my Honeywell device, room to room. I can chart on my EMR, Epic, Oracle, or others that you may use. And then instead of having to go to my nurse, my wow cart or my nurse station and just type into a computer what I was doing, I can actually just dock my mobile device into a charging base that Honeywell provides, but it also connects into a larger screen. And so all of a sudden, instead of having to use a computer and a device, you can take your device and it becomes your computer because it can share, it can mirror, or you can have a dual monitor display on what you're looking at. And so now I can go, instead of pushing a wow cart room to room, yeah, we're seeing health systems start to change their workflows a little bit. And in each room, they may have an arm with a monitor on it, and then a nurse will just walk in, dock his or her device, put it there, and that becomes your computer, and you can use that throughout. Or outside the hospital too, inside warehouse solutions, you can go monitor inventory, take test samples if you need to, and then come back to your desktop at your computer or in your office, and this becomes your computer by just docking it into the station. Now I can visually see what I just looked at, and also now do work as if it were a full-on laptop. Or even remote health or other areas too, as we move outside the hospital, this is becoming a multi-tool device that changes and really transforms how you do workflows into a simpler single solution.
I love your terminology for we call them workstations on wheels or computers on wheels over here. I
Yep.
think Wildcat's actually a lot more of a fun name. We should have adopted that one. That would probably have that might have helped with the brand the branding and certainly the love of calling out for I'm going to get my Wildcat. I guess that just-in-time delivery is a big part of what hospitals would love to achieve, right? They carry huge inventory. They're very complex environments. Some of the inventory is hugely expensive, and you need to make sure you track it from a clinical perspective, but also from a cost perspective. Waste is something which frequently comes up in reviews within the hospital system, and waste is something which is obviously always the enemy in the supply chain. You talked a bit about the people in the warehouse, for example, be able to use that tool for being able to scan test samples, whatever. I guess there's also a lot of samples and things which have to be attached with barcode and then obviously need to be attached to patient records, and that needs to be Loctite. Can you share a little bit more about what Honeywell does in that space?
I think we do play a role in a variety of spaces. It's not just a single device solve it all, but it's incorporating the full portfolio or full solution suite in most cases. And so sometimes if supply chain isn't labeled properly, if it doesn't have the right uh, if it's barcodes at all, or some cases handwritten notes, you're going to lose things and things will fall through the cracks, literally. So, using Honeywell's printing solutions, we can identify and print barcodes immediately as soon as they're needed. So, for example, in a hospital setting, working with an organization, and then when they do blood draws, so they draw the blood from every patient in their entire hospital every morning before 7 a.m. And so it's an early start or a late night, you pick. But they'll draw the blood and they're printing out a label on their vials, a 2-inch label that goes onto the vial, and immediately it's scanned inside the EMR and it's tracked. And so automatically we're getting the right information with the right patient at the right time and the right dose from the clinical space, and then that is transported out to be tested into the labs and then verified in other sites. And each area or spot it goes to, it's being scanned and tracked. And so using Honeywell technology throughout the whole process, we're printing the label, scanning it, and understanding who's using it and who touched it last, which is just helping with compliance and that overall chain of custody. But then back to your supply chain point, it also is giving you awareness of what you currently have. And that references it's humans blood draws, but it's also the same application for specimens, medical devices, anything that could be purchased or moved from one site to another. We're tracking, able to print labels, and able to understand where everything as it is at every point in time. And so the value is a lot of cost savings, but not just cost, but also time. Instead of having to locate where something is, we've been able to synthesize and help organizations focus on exactly where they have it, what they need, when they need it.
Yeah, and look, I know that Honeywell have a long track record of making sure that these things that your investment is protected over a long period of time. That's obviously a big concern for hospitals too. That they buy this equipment to do things, they need it to perform, they need it to stay up, they need it to be able to deliver over a long period. And I know that's a big part of the Honeywell solution also. I might switch gears just a little bit now, Will, and ask you
Sure.
perhaps about two pieces or a question in two parts. The first is the trends that you're seeing that are kind of are really emerging in the market with your customers, the things that are just starting to be you're starting to engage with and starting to talk about solutions for. And then maybe also as an extension of that, what do you think might be coming further down the track? So in 3 to 5 years' time, where you think this kind of non-clinical space might be emerging to?
Yeah, has anybody heard of AI before? Artificial
I
intelligence?
never heard those letters before. No one's ever used them before. I don't know what you're talking
No,
about.
I'm sure. I think that's top of mind in some cases. I think at a broad level, if I take a step back, it's modernizing, but also how health systems can automate things. For example, we're with a health system, and they have a courier service that they use to move specimens, other medical devices. We partner with an ISV, and they move things from site to site, and it just allowed them to gain visibility, allowed the users to have on a single solution track where things are and also where they are and where they need to go. And so I think just simple modifications in that sense, but also from an AI standpoint, I think health systems are looking to use AI in a variety of areas. But the two things I'm seeing are how can all these different AI tools and agents that Honeywell and others are creating be used together to make it more seamless, make a simpler process, a smoother process, automate it. And then the second area is around prescriptive analytics. And so I'll give you two examples, or preventative prescriptive analytics. So I'll give you two examples how to automate things. If we just take Honeywell as an example, we have a solution called Smart Talk, which allows you and I, we could talk on the phone, communicate back and forth, video chat, text, etc. And so another solution we have is workforce intelligence, which is like a task management software. And so I could assign a task, hey, Mark, you need to go clean up on aisle three, let's say, for example. So let's say we're in the supply chain. You and I have our Honeywell mobile devices, or it could be a non-Honeywell device. We prefer Honeywell though. And I send you you're the store, or you're the warehouse manager, and you're saying, hey, Will, we have a spill on aisle three. We need you to pick it up. And so you texted that to me on my Honeywell device, and I received it at the same time. Using our tools and leveraging AI, we've been able to take that message and assign a task automatically into my workflow so that I see in my task management system, hey, I'm going to drop this pallet, if we're talking supply chain here, drop these devices in the supply chain. Then I need to go clean up aisle three. And I see that. And now I can go, it's assigned to me, and now I can go do it. And so it's a simple example of taking two separate sort of solutions, but able to combine it together and just automate a workflow. That way I see it when I need it. Another area is preventative prescriptive analytics. So we have a tool, Honeywell, just use this as an example again. In healthcare, we talk a lot about preventative care, and how can we do things now, set up a lifestyle or cultural change to now that'll prevent you from needing a major healthcare, hopefully down the line. One of the tools I relate to that in our space is called operational intelligence. And what we're doing is taking a lot of data points of our devices and now expanding to other devices too, and being able to say, hey, based on past experiences, how much you've dropped a device, how much, or who's used a device, how much it's been scanned, or if you've lost it, based on all this history, we can start to say not just what has happened, but say and predict and then recommend by prescribing what will happen. So, for example, let's say a device has dropped a lot, one single device in one certain workflow. We've recognized that, and now we can start to devise a health system or in their supply chain, or if you're a remote frontline worker, hey, based on this workflow, maybe we should recommend either a different device or change how you're using that workflow to help extend your total cost of ownership with your device and your solutions. And so it's just a couple areas how we can automate AI, but then also use a lot of data and analytics used to prescribe health systems and other organizations to better use the technology they have across the organization.
So it's I think AI is obviously a really everyone loves to talk about AI, and
Yeah.
AI powers everything. But from what I see of Honeywell, you've got a really unique position in that you're used to managing, I guess, the physical side of, the human, but also the physical inventory side of things.
Yep.
And I use inventory in the broadest possible term, right? Inventory is not just about the number of medical devices you have on the shelf, or the number of blankets or beds, or whatever, but also inventory could apply to patients, anything that's got a physical identifier that's required to be tracked through a system. You've got solutions to enable people to do that, but you've also got great experience in combining all of that, taking all that information and putting it into and integrating it into hospitals, or to broader systems, to actually be able to work out how to make it useful. And I think that's something which maybe is often missed in the AI conversation, is that you need that information to be able to apply the AI to it, right? You need to be able to funnel that
Yep.
information to the right point to make it work. I think Honeywell's really well placed for that. Um, Final question for me, Will, is probably the second part of that question, which is, if you look to the future, and I know that Honeywell has a big investment in working out sort of the future of perhaps, maybe live from the consumer side of things, how to improve the temporal experience, and anything involving multiple pieces of inventory, or multiple moving pieces, that you want to be able to track what's happening in and out of rooms, or in and out of stores, or in and out of environments, warehouses. If you look at the next four, and I've just led you into this, I guess, but please feel free to talk about whatever you want to. And then the next phase, so beyond what's happening just now, do you see some things on the horizon that you think we should be thinking about for those who are looking at solutions and starting to think about what the world might look like, the future of non-clinical healthcare? Are there things that people maybe should just be thinking about and investigating a bit that you can see perhaps 5 years, 5 years down the track?
It's tough as soon as I say something that's out of date, right?
100%, 100%. I'm asking you to look into your telescope into the future, get in your DeLorean and
Yeah.
just shoot forward and tell us. But you know, you've got great experience. You know what's happening in the market. There's probably some things that you have a feeling might be something that you could share with us.
I think it's I go back to that term connected, but I think it's the connected worker, the connected employee, and it's again uh, taking multiple solutions and putting it into a single spot. And how can my single employee do more with less? And that could be, I know it's a basic, we've hit it, but I think that continues to be the focus of where a lot of developing countries, and I'll backtrack a little bit, like the U.S., Australia, New Zealand, I'm sure too, are facing labor challenges. Some of that in the healthcare space specifically as a result of COVID, and others just in general. And so, how can we make our allow and enable our employees, our frontline workers, associates to be more productive and actually do more with less? And so, I think it's providing yes technology, but also connecting our systems and then working well with other systems that maybe Honeywell doesn't do. So ISVs or other organizations. Just to make an easier experience for the employee and also allow them to do their job better and well. And I also think I, AI is, of course, the big term, and we mentioned a couple things that Honeywell's doing and even how that plays into the healthcare space. But I think I see how can we use people aren't going away. I think people there's a human touch, especially in healthcare, that we need, and that makes a drastic impact on people and their care recovery. And so, how can we leverage AI to work alongside and enable or augment humans in the work we do, but not let that overtake how we serve or how we give care. And so I think AI is going to continue to play a role in augmenting decisions, helping identify, hey, if we look at clinical space like X-rays or things of that nature in that world, but also it's not going to take away the human side that we actually have to make the decision. For example, if I look outside the clinical space, I think I see a focus in the US, and I know other countries may not be there yet, but how can we start to use robotics in some cases and use other technology to automate and modernize what we're doing outside the hospital because there's labor shortage and labor challenges. It goes back to that same theme. And so it's slower in healthcare in some cases, but I also see a lot of things speeding up too. So it's balancing a few different acts, but I think continuing to modernize and look at AI to augment people and help them actually accomplish more with what they're doing is a big focus across the healthcare system.
Yeah, absolutely. I think our mantra in our mobility part of Wavelength's business is really about how do we enable people to be able to do their job where they are without compromise.
Yep.
And I think that's going to be critical because if I think about our lives personally, we carry around a computer in our pocket now and enables us to do so many things that we don't need to go to a physical bank anymore. We don't need to if you're one of my children, you barely use the phone to speak to people. You only use it to message people. That's the way we communicate.
Yep.
In many respects, we lag in that respect in the working world in healthcare because of the regulatory environment and because perhaps of the fact that there's a lot of demand around evidence-based outcomes. It takes time for that change to come, and I think I think you're right. I think that connectivity and perhaps that interoperability maybe
Yep.
is a buzzword, but that's going to become more critical as we go. Um, well, thank you so much for making the time today. Really appreciate it. And for a bit of extra time on top of the webinar from last week. I look forward to hearing more from you hopefully in the future because I'd love to know in a couple of years' time whether your predictions have come true. We can check back in and compare notes.
Absolutely. Don't quote me on anything, but well, yeah, I appreciate it. You
Well,
included me.
we've written them all down, and thanks so much for giving up your time. Appreciate that. It's as I said, you're dialing in from the other side of the world, and again, it's a fantastic opportunity for us to demonstrate the value of that ability to use technology to our advantage to gain extra knowledge. It underpins the whole conversation really well. So thanks so much.
Absolutely. Thank you for having me. I enjoyed it.